Today, we're going to unravel a medical mystery. It's a story that kicks off in a tiny Nigerian village, but it quickly spirals into a challenge for scientists all around the world. It's about a brand new, deadly virus, the incredibly brave people who faced it first, and, the amazing science that fought back.
So think about this for a second. What on earth could possibly connect a dedicated American nurse, a quiet village in Nigeria, and a lethal virus nobody had ever seen before? Well, that connection, that's the beginning of a really harrowing story that actually changed modern medicine.
All right, so to really get this, we have to go back in time. We're heading to 1969, to a village called Lassa, which was, tragically, about to lend its name to a terrifying new disease.
So picture it. It's 1969 in Lassa, Nigeria. Out of nowhere, people start coming down with this strange, really high fever. And the local doctors, they are completely stumped. Whatever this thing is, it's aggressive, it's spreading fast, and they have no idea what they're fighting.
The very first person to be officially identified with this illness was a nurse, a woman named Laura Wine. Now, she was already retired but just couldn't give up her calling, so she chose to serve at this small mission hospital. She literally came to Lassa to help save lives, but she ended up becoming the first documented victim of this brand new medical crisis.
Laura Wine's illness was just brutal. It resisted every single treatment the doctors threw at it. They rushed her to a bigger hospital, but she died in less than 24 hours. And the horror didn't stop there. Two of the nurses who had been taking care of her, Charlotte and Penny, they soon came down with the exact same symptoms. Charlotte died too. Penny was so close to death she had to be airlifted all the way to New York, where she, just barely pulled through. This terrifying chain reaction was the first big clue. Whatever this was, it was unbelievably dangerous, especially for the people trying to help. So you can imagine, with healthcare workers now dying, the global medical community just went on high alert. The race was on to figure out what was going on. What was this invisible killer?
After a ton of intense lab work, scientists finally identified the culprit. It was a single-stranded RNA virus from a family called Aranavizidae, and following tradition, they named it after the place where it first reared its head. The mystery finally had a name: Lassa virus.
But, okay, where was this virus coming from? Where was it hiding? Well, scientists knew it had to have a natural host, right? The investigation led them to a really common rodent, the multimammate rat. And these animals, they're not shy. They live right alongside people, in their homes, in their food storage, creating this perfect, dangerous bridge for a virus to jump from animals to humans.
So we know the virus lives in rats, but how exactly does it get from a rat into a person? And even more critically, how did it then spread from Laura Wine to the nurses who were just trying to care for her? That's the next piece of the puzzle.
It turns out there are two main ways this virus gets around. The first path is from animal to human. And the second, of course, is from human to human. And if you want to stop an outbreak, you have to understand and break both of those chains.
That initial jump from a rat to a person? It often happens without anyone even realizing it. Someone might just eat a bit of food that a rat has contaminated with its urine or droppings, or maybe they just touch a surface where an infected rat has been. In places with poor sanitation, this bridge between the animal world and our world is dangerously easy for the virus to cross.
Now, once a person is sick, the virus can spread to other people through direct contact with their bodily fluids. And this is precisely how nurses Charlotte and Penny got sick. It just highlights this terrifying reality. Hospitals, the very places that are supposed to be for healing, can become hotspots for an outbreak if the right precautions aren't in place.
So what does Lassa fever actually do to your body once you're infected? Well, the way this virus operates is part of what makes it so incredibly tricky to track down. So here's maybe the most surprising thing about Lassa. For about 80% of people who get it, they show no symptoms at all, or maybe just a really mild illness. And that is what makes this virus so dangerous. It's like a stealth operator, spreading silently through a population long before any alarm bells start to go off.
But, and this is a huge but, for that other 20% who do get sick, the disease can be absolutely devastating. Of those who get sick enough to actually be hospitalized, the fatality rate can be as high as 15%. So you have this really dangerous paradox. Most people who get it are fine, but if you're one of the unlucky ones, it is a life or death fight. At first, it might just feel like you have the flu, a fever, weakness, headache, maybe a sore throat. But in the really severe cases, it turns into something out of a horror movie. Patients start bleeding from their gums and their nose, their face swells up, and their organs just begin to shut down. And even for those who manage to survive all that, the virus often leaves behind this permanent scar. Deafness is a startlingly common complication for survivors.
Another huge challenge for doctors is the incubation period. That's the time from when you get infected to when you actually feel sick. For Lassa, that can be anywhere from 1 to 3 weeks. That long, variable window makes it incredibly difficult for health officials to trace who might have been exposed and where the virus is going next. Okay, so after hearing how dangerous this thing is, what's the good news? Because the story doesn't end with its discovery. It continues with how we've learned to fight back. And the good news is, we are not powerless against Lassa fever.
Our main weapon against Lassa is an antiviral drug called ribavirin. The absolute key is giving it to patients as early as possible. When you combine that with good hospital care, just to manage the symptoms, it dramatically increases the chance of survival.
Of course, the best fight is always the one you don't have to have in the first place. Right, prevention is everything, and it really breaks down into 3 pretty simple parts. First, control the source. Better community sanitation means fewer rats. Easy. Second, protect the community. Simple things like storing food in sealed containers can make a huge difference. And third, and this is so important, protect our healthcare workers. With the right protective gear and safety protocols, the kind of tragedy that happened back in 1969 should never, ever happen again.
And this really brings us to the most important question of all. The story of Lassa, it started in just one village, but its lesson is for the entire globe. We live in a world now where an outbreak in some remote corner of the planet can be in a major international city by tomorrow. A local problem is now everyone's potential threat. So the real question Lassa forces us all to ask is this: are we ready for the next one?